Hi everyone, welcome back to Annual Conference Live 0 to 3. I'm Will Hallex. I want to give a reminder before we get started here to go to 0to3.org/AC-Live and sign up, put in your email. We have a couple of giveaways coming up and a little bit later today we're going to be giving away 2 free 0 to 3 memberships. 0 to 3 memberships, and also 1 free registration for next year's annual conference in Fort Lauderdale, Florida. Something you're definitely not going to want to miss. Again, that's 0to3.org/AC-Live. In the meantime, thank you very much for joining our fireside chat on medical child abuse. We're here with Suzanne Schunk. She's the Vice President of Family Support Services at Southwest Human Development in Arizona. Suzanne, thanks for being here.
Thank you. I'm delighted to be here. I think this is an extremely important topic and an extremely good audience to be listening to.
Well, absolutely, yes. Let's dive right in. Your session is on medical child abuse, which is also called Munchausen's by proxy. I'm hoping you could just tell us a little bit about how prevalent it is.
Thank you. Munchausen by proxy is the term most people have heard. It's used pretty frequently through the media, and it basically means that someone, usually a caregiver, has imposed illness or disability upon a child. It's not true, it's fabricated. Sometimes it's done by exaggeration. They can exaggerate symptoms, they can lie to doctors and say there's symptoms that don't exist. Sometimes it's more serious and the parent actually induces something into the child to cause the illness. We call it medical child abuse in the child welfare field because it's a much easier term, it's quick and easy. The medical field likes to say it's abuse by pediatric illness condition or pediatric condition falsification. So there's many terms, and the diagnostic term is factitious disorder imposed on another. Nonetheless, Munchausen by proxy is what people have heard, and it is a very serious issue. Parents literally make their children ill, or they claim the child has autism or some developmental disability or allergies or things like that, and all of that is false.
And can you describe the effects of what you see among children in these cases?
Yes, children suffer very seriously. We're talking about many medical tests, surgeries, and all kinds of doctor visits that are unnecessary, hospitalizations that are unnecessary. They get blood tests, they get very, very many interventions. And sometimes these children are accused of having feeding issues. G-tubes, feeding tubes are implanted needlessly. They have been induced to have vomiting and diarrhea, and they have all sorts of tests. It's very common for parents to say the child has autism, when indeed they don't, and they get years of services for that. They may be also accused of having violent rages and terrible behavior problems and be homicidal or suicidal and end up in psychiatric institutions and on psychiatric medications. So these kids go through a huge amount. Sometimes they're in wheelchairs when they don't need to be.
Absolutely, and basically what we're talking about with Munchausen's by proxy is caregivers fooling medical professionals and doctors,
Yes.
right? So what does that look like? How does that happen?
Doctors are taught to listen to parents and to listen to patients. Obviously, with very young children, the patient can't speak, so the parent speaks for the child. And in most cases, that's perfectly good. It's honest. But in a few cases, it gives the parent, a caregiver, an opportunity to lie, to exaggerate, make up things, and tell doctors falsehoods that then cause that doctor to treat the child for illnesses they don't have or that were induced. The other thing that they do is that if I go to a doctor and I say my child has autism or my child has allergies or whatever, and the doctor tests and says, no, I don't think so, I think your child's fine. Most parents would be thrilled, but I would not be thrilled. I would go to a different doctor and I would say, the doctor I just saw diagnosed my child with autism, and it goes from there. So now the child has a diagnosis which the child was never given by any medical professional.
And that sounds like one of the probably concrete signs of that a parent is doing this. So what are some of the other signs for professionals in the audience that this may be happening?
Doctor shopping is a big one. Being unhappy with test results, normal test results, demanding more tests, being more interested in how I am as the caregiver and how much this costs me, how much pain I'm going through, than the pain my child suffers. Being quick to give my child more tests, not hesitant at all. Being very friendly with doctors and nurses and wanting to know all about their personal lives and making friends with them while the child sits in the hospital bed alone. Things like that. Demanding that the child has, or insisting the child has seizures, for example, but no one has ever seen the seizure. Only the parent has said it occurs. Insisting the child has other kinds of illnesses. Nobody's ever seen the symptoms. Those are pretty much highlights that you can at least suspect. It doesn't mean for sure, because there are indeed children who are undiagnosed with some serious illness. But where those things are happening, you need to question. When a parent tells you there's a diagnosis and you don't see it, for example, autism is very common in the young, early childhood field. If your evaluation says this child doesn't have it, and that parent cannot produce a record that shows the child's been diagnosed, even when they do produce the record, though, you have to be careful because they'll falsify records. Go back to the original person who supposedly diagnosed the illness or the autism or whatever the delay may be. Ask, did you indeed diagnose this? It's very important.
And I know that you got a question after your session on this about how to tell the difference between something that might be Munchausen's by proxy or an actual diagnosis. Are there any other ways that professionals should have in mind to be able to tell that difference?
Yes, but what I want to say is it's very important, as I said in my workshop, you do both. You suspect and you check. So the suspicion alone, you're going to call CPS. You may be checking with some other doctors and trying to get some other information. But at the same time, you do want to continue to make sure the child has been tested for metabolic or chemical or genetic diseases. Make sure, rule those out, because we want to be certain the child is healthy. We don't want to have an undiagnosed illness that everybody assumes is medical child abuse.
Yeah, absolutely. And we talked a little bit before we started rolling about I think the rise of exposure of Munchausen's by proxy in the media and in different stories and movies and books. Can you talk a little bit about what that looks like, and and is it a good thing that this is getting more exposure?
It's great that it's getting more exposure. The most important thing we can do in this field of Munchausen by proxy or medical child abuse is get the word out. I had many people in my workshop this morning who took my PowerPoint and said, I'm taking this to CPS because they won't believe me. They won't listen to me about this case I have. They need to hear this information. We cannot get enough information out about the seriousness of this problem. Medical child kills 1 in 5 children. I'm sorry, 1 in 15 children. All the other kinds of abuse, the most serious physical abuse, 1 in 500 die. So this is a very serious, lethal kind of abuse. We need to get the word out. Yes, there's a lot of stories on the media. There's a lot of true stories, and I encourage people who are interested in this to go to YouTube. All you have to do is put in YouTube Munchausen by proxy. You'll get many true stories. There's Gypsy Rose and Blanchard, and there's Hope Ibarra, and there's Mommy Dead, Mommy Dearest. There's quite a few out there. Those are the most serious cases. They're the ones that make the news, where typically a child dies, sometimes not necessarily a death, but real serious inducement of poisons and things like that into the child. Medical child, though, can be much less serious than that. It can be a lot of lies and exaggeration of symptoms. It doesn't have to be the inducement of something to make my child ill. Many times, for example, it can start with a child having a real medical problem. For example, we had a family where a child was born with a very serious eye infection, and within the first year of her life, she lost one of her eyes. That mother became exceedingly anxious over the care of that child. Every little tiny medical thing, she was terrified this child was going to be seriously ill. She was terrified the child would lose the other eye, to the point that she would lie and say the child was physically disabled and needed a wheelchair at school. She said the child couldn't walk and couldn't do PT in school, things like that. She would lie to protect the child. She never induced anything, but at the same time, it was medical child abuse.
Absolutely. So for the professionals in the audience, can you share some resources if they're looking to learn more or incorporate this into their work?
Yes. First of all, the American Professional Society on the Abuse of Children, APSAC, APSAC, has guidelines on Munchausen by proxy that are phenomenal. That I strongly recommend the guidelines. There are 2 books that I would highly recommend. They're very readable, very interesting, true stories from survivors of medical child abuse who are now adults. One is called Sickened, 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 by Julie Gregory. And she talks about the medical child abuse she suffered. And the other is called, funny name, Beyond the Monkey Bars. The monkey bars in a preschool playground, Beyond the Monkey Bars by Troy Kane, Kane. And he writes about the terrible psychological medical abuse he went through and how he was hospitalized and accused of all these terrible things that he did supposedly at night, and he had no recollection of doing. And he never did, of course, but he thought he must have somehow dreamed and done some of these things sleepwalking. It was dreadful.
Well, thanks very much. And for professionals out in the audience as well, you can also explore some related resources. We're going to post at 0to3.org/AC Live. That's the place that you can go for more information on our fireside chats as well, coming up later today, and to put in your email for notifications about them. The next one's going to be at the top of the next hour. That's 1 p.m. Mountain Time. It's going to be on maternal mental health. In the meantime, Suzanne, thank you so much for joining us.
Thank you so much for having me. I think this is a very important topic, and I'm glad to get the exposure.
Yes, thanks for taking some time, and we'll see you soon.